Thank you very much for this kind introduction. Thank you for having me here. I'm an urban designer, an architect actually by training. Now I work in the urban design development department. So I'm interested in how can we design healthy behavior, positive health effects into urban environments. And I come from a city of Darmstadt, a small university town south of Frankfurt, where actually most of the health aspects that we're dealing with are related, at least from the perspective of an urban designer, to physical activity. But it's really interesting in this conference to hear about very many different other aspects of health, and especially to look at this on a global side. So thank you very much for inviting me here. So yeah, I mentioned I'm from the background urban designer, but what I want to bring to the table here today is our experience on, one could say, engaging young people, and especially with digital tools. So GIS is only one aspect to it. That's of course the aspect we as urban planner bring to it. When I say we, then I mean the small research group that I have the honor to, or the privilege to lead, that is in itself interdisciplinary. So we have architects, PhD students that I supervise in the group, but also the odd psychologist PhD student and two IT experts that do their PhD in computer science. And we work closely together. What we focus on is how can we develop together urban design solutions to tackle those global health challenges that we're all interested in. Most of it is related to mobility systems. So the question, how can we really develop cities to be less car dependent, is of course a big question. And it's also related to, do access for all, really implement that and pushing this further for public spaces. One aspect that we're focusing on is, how can we involve young people more in the process? And that is what I want to focus on today in this talk. By the way, you really have to be careful with me with the time, so when I'm over the time, you just mention it and I will stop and we'll have the chance to talk later in the discussion. So why is, I think, young people really interesting to look at as a target group? You all know The Lancet as one of the most important medical journals in the world has recently, in 2016, had a commission on adolescent health, who brought to our attention a lot of, let's say, benefits to invest, especially in that age group. We think, and we as, in that case, a dear colleague from University of Virginia, Jenny Rowe, and I, that, they kind of have not paid enough attention actually to the built environment. And on the other hand, we know that in urban design and health, in that it seems to be a research discipline that seems to be exploding really over the last 5 years, but it was really strong connected to the idea of demographic change, and has therefore as well focused a lot on the affordances of the older generation. So I think it's time to kind of re-emphasize that and as well focus more on the affordances of young people. What we're developed and what is going to be published actually in the next few weeks is a model in which we want to consider, and you see that here on the right hand side, consider all the possible factors that, of course, especially in that age span where there's so much about transition and changing everyday practices, which pays attention to that, but as well considers the possibilities that we have as planners to be a bit more responsive to adolescent affordances. So this is what we call adolescent responsive design process. Today I want to present you one kind of aspect of that is how can we use digital tools in that process. This is the research question. We can just skip over them. I want to basically make two arguments here. I think that what we call mobile participation, it's a definition from a colleague from Berlin who says mobile participation, that's all basically that use mobile devices and is therefore kind of used, for example, in open spaces as social interactions, where social interaction happens and where potentially also health-related behavior happens. So one, mobile participation is particularly suited to engage with young people. That is like the working hypothesis number one. And the second point that I want to make is that all those tools that are available, apps as well, connected apps to kind of like more big data and data visualization tools, are really tools that we can use and that we have to learn to use to go towards something that one can call evidence-based urban design. I don't want to go that far. I don't think we're there yet. But probably that's kind of like, I think, something that is really to think about, like when we have to justify investments, where we have to also prioritize investments, to in urban design come way more to the front, to where we collect evidence and where we collect empiric data. So I think mobile participation can help to those questions. And I basically want to show a few projects, if the time allows that. The first project that I want to show is a smartphone game that we designed and developed in Frankfurt am Main. And you see here the kind of the area where that took place. So this is the public transport map of Frankfurt am Main. And this was a small space that we worked on, which is at a big route in Frankfurt that's called the Automeile. And that is the street in Frankfurt that has the biggest density of car sales representations. 4-lane street. So this is an area that is just about to be developed. And our goal was to kind of like make people aware that there is a kind of a future after being car dependent that has a lot to do with positive effects of the environment on health. What we did is we designed that location-based game, which goes over a route of let's say, circa a kilometer. You would walk with your mobile device through those built environments, and you would interact, on the one hand, with the locations that we picked and that we kind of like curated, and on the other hand, you would interact with kind of like your bio data. So we were able to, and you see that here in this picture, to sense the pulse and heart rate of people with the smartphone camera, to give you kind of an idea in this station where you would kind of like measure your pulse, and you would make a breathing exercise along those blue infrastructure, measure your pulse again, and would have kind of a glimpse, okay, is this a positive health effect? To just briefly show you how that looked like, brought a small video. So this is the area you see, the Automeile, where we kind of, with our research group, went to that place, took a workshop, brought the devices, handed them over to our participants, and they kind of went on their way through the urban environment. So here you see kind of how they interact, how they get to know the area through a different angle. Here's the pulse measuring and the breathing exercises. Different sorts to interact with the architecture. Here we had a long ramp where actually lorries are being loaded and so on, and the task was kind of to balance an egg on your smartphone, so make use of kind of the accelerator sensor devices of the smartphone. Okay, so all sorts of interaction through the mobile phone to kind of, with the goal to get to know what are effects from the built environment on how we move through everyday life, and what are effects that kind of do you well, you know, that benefit your well-being. Okay, this is kind of an interaction where you took photos and we curated kind of a dance along that street according to the photos that you took. Okay. Good. This was some of the results that we took. You see here, of course, the GPS tracks of all those players. That's for 42 players in the whole. We had them rate the certain spaces afterwards, and you see kind of the very difference in perception. This is this very rude here on the main street, which is rated very stressful, very loud, lack of vegetation, lack of seating, and so on and so forth. So this allows us to give like kind of make profiles of certain spaces and then accordingly handing them over to urban planners that will redevelop that area. This is a thing that I want to draw your attention to because I've made the claim, okay, we can actually get to new user groups. Here you see the age distribution of, let's say, a related project, Ingress from Google, who has kind of like targets like most of the time 19 to 29 age group. So this is our age distribution here. We were in the same kind of the same people that we targeted. Ingress had 6% female users, opposed to 94% male users. So we were, compared to that, we were pretty good. We had 60% of female users. And you see here on the left-hand side, you see kind of a typical participation tool, a digital tool, just a website by the city of Darmstadt. You have a completely different age distribution. You have way more here in the years of 40 to 49. Okay, so this was the experience from using a location-based game, more to kind of learn health skills, one could say. Yeah. What was interesting is the table that that the colleague just showed was interesting to kind of like really go into physical activity and what different age groups, what are their needs. And we saw that in that game as well, that people, of course, of different age would react and would interact with the game in a different way. So all sorts of stations that were super physical active and like would need a lot of exertion. Of course, that was something for the younger ones, whereas like the photo dance that was way slower and was way more about percepting and finding stuff in the built environment was actually something that all the ages liked. So we thought that is a good potential where we could also kind of bring different people of different ages together and talk about what do they need or what do they accept from the built environment. Okay, we have now adopted that to another setting that is very relevant in Germany at the moment. We are going to have so much investment and will need so much investment into rebuilding our schools. So this is called MoMA at School. It's an app where we, according to the game I Spy with my little eye, ask like primary school students how do they perceive their schools, which actually places in their school do they think or do they enjoy becoming active, and which spaces in their schoolyard do they perceive as being stressful and so forth and so on. I don't want to go into too much detail. You get the idea. We have right now data of 72 primary school students that we're currently and analyzing and visualizing, and our goal is to kind of like build a toolbox that would be able to, that we are able to kind of travel between schools to really build a database on like what are active spaces in our schools, and to, well, eventually design schools in a more promoting way for physical activity. Okay, those are the primary results. So in the first part, I kind of like showed you two examples showing that okay, we can engage with young people. We can through digital tools even say okay, we have the chance to give them a voice. It is important to kind of tailor those experiences, and it's a challenge to tailor those experiences. But it's as well like the medium of digital tools has this chance to be really specifically tailored to certain age groups. Important field of action is in raising awareness, is in like developing health skills, and is as well in education actually of planners. So far, the field of urban design and health is super underrepresented in our school curricula, and we are using those games as well to kind of change the perspectives of our students. Okay, if I have a bit more time. 3 minutes, that's enough. I want to go a bit more into detail why it's important to kind of collect data in really high spatial resolution. This is a project where we were interested in what are the urban factors of urban stress, or the factors related to built environment. and where we did a survey, online survey, where people showed us the places in Darmstadt that they perceived as most stressful. You see here on the map, kind of the distribution over the city. Most of those red, most stressful places are in the city center, are related to kind of like building density. But we were wondering, so what other factors are out there? This is an example where we overlayered those subjective perceptions with kind of like classic spatial analysis tools such as space syntax. This doesn't mean anything to anyone here, apart from those few planners probably, but it's a nice tool to kind of quantify how our cities look like and how the structure of our cities are. What we showed here is that the street network analyzed, you see here in the red segments, you see those street networks segments that are super well integrated, and that means that there's the most motorized traffic. That those, of course, correlate to those spaces that are rated as super stressful. So this kind of has an implementation that confirms kind of really the need for more tempo reduction, for speed limits, traffic calming in our cities, and to really work more on walkability. We were able to kind of build a model from that where we just use kind of those 4 factors: building density, street network, and isovis, that means like what can I see from my eye level, and space typology to predict people's ratings of what places they perceive as stressful. Okay, now I have 1 minute, and that will be enough to kind of go into one more step. How kind of deep do we want to go into this? Like, so we remember kind of our question is, as urban designers, what are really elements that we can change? Yeah? And if we go back to this slide, if you look at those factors, building density is super hard to change with urban planning. Yeah, it's kind of, we can try to regulate it and keep it at bay, but it's not so easy to change, especially not in cities that are already developed. The same is with space typology, so by that we mean parks, and that is basically determined by land use patterns. But where we have an influence is on our street networks and how they are designed. Where we have an influence is on what we actually see on an eye level. Okay, so here we use a research tool, it's an app as well, where people can rate public spaces, and this works a bit different. We give the smartphones to the people and say, look, we are in an open space, you show us that area and that open space, that stresses you out, yeah, that you find super stressful. So people walk around in those public spaces here, and they rate according to 10 adjectives, like including loud or not loud, green, gray, and so on and so forth. You see here an example of like of 3 different public spaces. You see here in park. So green is where they rated it as relaxing. Red is where they rated it as super stressful. You see here this main public transport hub, where you see kind of along the tram line, actually, you have those pockets of red ratings, whereas like away from the public transport, so in very much pedestrianized areas, you have those green ratings. What I like particular about that experience is that you have, of course, subjective ratings, but because people were doing it together with the smartphone in the public space, they were also beginning to talk about their experience and their ratings. And of course, at a certain amount of people that we ask, we can even talk about intersubjective ratings in that level. So this is one more level in, zoomed in. This is where people kind of, we see the arrow with the accelerator of the smartphone, where they look actually when they rate it, and we have the photo of what they rated. And this is then kind of like visualization in GIS. This is the only time I use the word GIS in the whole talk, where we can use then to go to our mayors and to our planning department to hopefully inform the new redevelopment of that space. That's it for me. Thank you very much.
Thank you very much, Martin. Stay here for this very inspiring talk with the GIS in the end. Do you have questions? there's a question.
Thank you very much for your presentation. I'm from the city of Darmstadt. But my question is a very technical question, referring to your index, the stress index. Was it always the same persons on all places you examined, or how did you do this?
So it wasn't. Thank you for the question. It's very good. It was an online questionnaire, so there were 120 students. So it's of course very restricted in terms of like how representative it is of the citizens of Darmstadt. And they rated, so it was always the same persons, and they rated 20 open spaces. So broad selection of open spaces, including parks, including transport hubs, and different types of streets. So streets that were heavy trafficked, streets that were like kind of medium trafficked, and pedestrianized streets. So they gave us those ratings, and that is what we combined then with the spatial analysis. Yeah. And in our different, so this is the one setup where we kind of use the online survey. In a different setup, it is that we go with a smaller group, again of like different ages, where we go through the open spaces. We can then, of course, only deal with like selected spaces that we have already identified as either stressful or relaxing. And then we go with the persons through those spaces, and they kind of give us the ratings, and as well, in some cases, the biodata in the spaces.
Thank you. I have some question about the payment or pay from the did this game was pay from the budget of Basel or some program? And another one question is how much it cost?
Thank you. That's a brilliant question. Thank you. So this is something that we probably should discuss later as well. It's about like how can we fund this research. So I was lucky to get kind of an initial grant to establish that research group, and we needed that money in the first time to really build prototypes, to then go to city planning departments and say, look, this is to actually make it graspable for them what it is what we do. Yeah, and so now we slowly begin to like really getting research grants back and work together with the city of Darmstadt in two projects actually. I'm happy to tell you what it will cost you to work with us later on in a coffee.
So this has to be a secret until a coffee. Thank you very much, Matt.